Narcissistic Personality Disorder. Well, this is one of several types of personality disorders. It's a mental condition in which people have an inflated sense of their own importance, a deep need for excessive attention and admiration, troubled relationships, and a lack of empathy for others. But behind this mask of extreme confidence lies a fragile self esteem that is vulnerable to the slightest criticism. A narcissistic personality disorder causes problems in many areas of life, such as relationships, work, school, or financial affairs. People with narcissistic personality disorder may be generally unhappy and disappointed when they are not given the special favors or admiration they believe they deserve. They may find their relationships unfulfilling, and others may not enjoy being around them. Treatment for narcissistic personality disorder centers around psychotherapy. Well, earlier on this channel, I have already uploaded a short video about narcissistic personality disorder. I hope you have seen that, and today I am going to discuss this disorder in detail. Please note that this is a very important video because you may see people around you suffering from this disorder. Okay. Now, first of all, let me tell you the symptoms. Well, the signs and symptoms of narcissistic personality disorder and the severity of symptoms vary. People with the disorder can have an exaggerated sense of self-importance, have a sense of entitlement, and require constant excessive admiration, expect to be recognized as superior even without achievements that warrant it, exaggerate achievements and talents, be preoccupied with fantasies about success, power, brilliance, beauty, or the perfect mate, believe they are superior and can only associate with equally special people, monopolize conversation and belittle or look down on people they perceive as inferior, expect special favors and unquestioning compliance with their expectations, take advantage of others to get what they want, have an ability or unwillingness to recognize the needs and feelings of others, be envious of others and believe others envy them, behave in an arrogant or haughty manner, coming across as conceited, boastful, and pretentious, insist on having the best of everything, for instance, the best car or office. At the same time, people with narcissistic personality disorder have trouble handling anything that they perceive as criticism, and they can become impatient or angry when they don't receive special treatment, have significant interpersonal problems and easily feel slighted, react with rage or contempt and try to belittle the other person to make themselves appear superior, have difficulty regulating emotions and behavior, experience major problems dealing with the stress and adapting to change, feel depressed and moody because they fall short of perfection, have secret feeling of insecurity, shame, vulnerability, and humiliation. People with narcissistic personality disorder may not want to think that anything could be wrong, so they may be unlikely to seek treatment. If they do seek treatment, it is more likely to be for symptoms of depression, drug or alcohol use, or another mental health problem, but perceived insult to self-esteem may make it difficult to accept and follow through with treatment. If you recognize aspects of your personality that are common to narcissistic personality disorder, or you are feeling overwhelmed by sadness, consider reaching out to your trusted doctor or mental health provider. Getting the right treatment can make your life more rewarding and enjoyable. Now I'll tell you the causes. Well, it is not known what causes narcissistic personality disorder. As with personality development and with other mental health disorders, the cause of narcissistic personality disorder is likely complex. Narcissistic personality disorder may be linked to environment, mismatches in parent-child relationship with either excessive adoration or excessive criticism that is poorly attuned to the child experience. Genetics. There are some inherited characteristics that can lead to this disorder. Neurobiology, the connection between the brain and behavior and thinking. This can also play a part. Okay. Now I'll tell you some risk factors. Well, narcissistic personality disorder affects more male than female, and it often begins in the teens or early adulthood. Keep in mind that although some children may show traits of narcissism, this may simply be typical of their age and doesn't mean they will go on to develop narcissistic personality disorder. Although the cause of narcissistic personality disorder is not known, some researchers think that it is that in biologically vulnerable children, parenting styles that are overprotective or neglectful may have an impact. Genetics and neurobiology also may play a role in development of narcissistic personality disorder. Now I'll tell you the complications of this disorder. Well, complication of narcissistic personality disorder and other conditions that can occur along with it can include relationship difficulties, problems at work or school, depression, anxiety, physical health problems, drug or alcohol misuse, suicidal thoughts or behavior. Now I'll tell you some preventive measures. Because the cause of narcissistic personality disorder is unknown, there is no known way to prevent the condition. However, it may help to get treatment as soon as possible for childhood mental problems. Participate in family therapy to learn healthy ways to communicate or to cope with conflicts or emotional distress. Attend parenting classes and seek guidance from therapists or social worker if needed. Now coming to the diagnosis, when the patient comes to us, there are some features of narcissistic personality disorder which are similar to those of other personality disorders. Also, it is possible to be diagnosed with more than one personality disorder at the same time. This can make diagnosis of narcissistic personality disorder more challenging. Diagnosis of narcissistic personality disorder typically is based on signs and symptoms. A physical exam to make sure you don't have a physical problem or causing your symptoms. A thorough psychological evaluation that may include filling out questionnaires. Criteria in the Diagnostic and Statistical Manual of Mental Disorder, DSM-5, published by the American Psychiatric Association. Treatment for narcissistic personality disorder, the talk therapy. Now I'll tell you about some type therapy that is also called psychotherapy. Medication may be included in your treatment if you have other mental health conditions. Psychotherapy in narcissistic personality disorder treatment is centered around talk therapy. Psychotherapy can help you learn to relate better with others so your relationships are more intimate, enjoyable, and rewarding. Understand the cause of your emotion and what drives you to compete, to distrust others, and perhaps to despise yourself and others. Areas of change are directed at helping you accept responsibility and learning to accept and maintain real personal relationships and collaboration with co-workers. Recognize and accept your actual competence and potential so you can tolerate criticism or failures. Increase your ability to understand and regulate your feelings. Understand and tolerate the impact of issues related to your self-esteem. Release your desire for unattainable goals and ideal conditions and gain an acceptance of what is attainable and what you can accomplish. Therapy can be short-term to help you manage during times of stress or crisis, or can be provided on an ongoing basis to help you achieve and maintain your goals, often including family members or significant others in therapy can be helpful. Medication. There are no medications specifically used to treat narcissistic personality disorder. However, if you have symptoms of depression, anxiety, or other conditions, medications such as antidepressants or anti-anxiety drugs may be helpful. Lifestyle and home remedies. Well, you may feel defensive about treatment or think it is unnecessary. The nature of narcissistic personality disorder can also leave you feeling that therapy is not worth your time and attention, and you may be tempted to quit. But it's important to keep an open mind, focus on the rewards of treatment, stick to your treatment plan, attend a scheduled therapy session, and take any medication as directed. Remember, it can be hard work and you may have occasional setbacks. Get treatment for alcohol or drug misuse or other mental health problems. Your addictions, depression, anxiety, and stress can feed off each other, leading to a cycle of emotional pain and unhealthy behavior. Stay focused on your goals. Stay motivated by keeping your goals in mind and reminding yourself that you can work to repair damaged relationship and become more content with your life. Okay. So this was my video about narcissistic personality disorder. I hope you will like this video. If you have questions about narcissistic personality disorder or any other medical illness, please do not forget to post in the comment section. On this channel there are so many videos of medical physical and mental illnesses. Okay, you can see all those videos, and If you or your loved one is suffering from any illness for which video is not there, you can post in the comment section, and as soon as I find a time, I'll try to upload the video about that particular illness. Thanks for watching this video. See you in next video. Bye for now.